All right, buckle up, vet family. It's time for VetCast, where we dive headfirst into the latest and greatest in veterinary ophthalmology. I'm your host, Catherine Wilkinson, and today we're bringing you a distilled dose of brilliance from the 54th annual meeting of ACVO, held in beautiful Boston, Massachusetts in 2023. Now, before we jump in, a quick disclaimer. This episode was whipped up with a little help from our digital friend AI. We're talking highlights, not gospel. Remember, you're the clinician, you're the expert. Always double check those details, especially when it comes to your patients. I'm just giving you a little taster, a little nudge in the direction of some fascinating research published in veterinary ophthalmology. Because, let's be real, who has time to read every single paper? We're busy people. This allows you to pick and choose and then find out what you want to spend more time on. So, let's get started. We're going to give you 10 take-home points from this conference. So the first paper was 360-degree conjunctival grafting. First up, we're talking corneal ulcers. And boy, did these researchers get creative. A team from the UK, led by R. Allen, looked at 360-degree conjunctival grafting for those deep, nasty ulcers. We're talking dogs and cats here, folks. They even threw in some extra goodies like human amniotic membrane and small intestinal submucosa for some cases. So, what's the gist? Basically, they wrapped the conjunctiva all the way around the cornea like a superhero cape for the eye. There were 27 eyes in 24 dogs and 3 cats. Ulcers were of all sizes and depths, including perforations. And what was the result? A whopping 23 out of 27 patients had a successful outcome, meaning a retained eye with a positive menace response. That is some serious success. So, the take home? If you're facing a tough corneal ulcer, a 360-degree conjunctival technique could be your new best friend. And don't be afraid to add in those xenologous grafting materials for that little extra boost. Okay, paper number 2. Feline lens instability. To extract or not to extract. So we're diving into the world of feline lens instability. R. Aronson and the team at Tufts University crunched the numbers on 136 eyes from 115 cats. That's a lot of kitty eyes. So the data. It was mostly older male cats with a lot of anterior luxations. The decisions? Medical management, enucleation, or intracapsular lens extractions. Now, it turns out intracapsular lens extractions had a 93% success rate for maintaining vision, while medical management was about 65% for initially visual eyes. So, the take home? Intracapsular lens extraction looks pretty darn good, but medical management can be a viable option, especially considering factors like age, finances, and the ability to medicate. And remember, these cats often present with chronic, untreated disease. Early intervention is key. Paper number 3. Lacrimal cysts after third eyelid surgery. A pesky post-op problem. Ever had a patient come back with a weird swelling after a third eyelid gland repositioning? Benitez Vera and colleagues looked at 3 dogs that developed lacrimal cysts. The issue were large, fluid-filled swellings after surgery to fix a prolapsed third eyelid gland. What did they do to solve it? Surgical excision of the cysts. The result? Happy, comfortable eyes with no cyst regrowth. The take-home message? If you see a swelling after a third eyelid surgery, think lacrimal cysts. Surgical excision is safe and effective. Paper number 4, intraocular pressure measurement. Right, let's talk tonometry. B.R. Bergen and T.R. Miller compared 3 tonometers: the new IOP Vet, the Tonopen Avia and the Tonovet. They looked at normal and glaucomatous canine eyes, and the result showed that the IOP Vet showed good agreement with the other 2, meaning that the IOP Vet is a perfectly valid tool for estimating intraocular pressure in dogs. So if you're looking for a new thermometer, this one gets the thumbs up. Paper number 5, corneal ulcer diagnosis, a gap in the knowledge. O.H. Bolus and the Tufts team analysed corneal ulcer referrals, comparing diagnoses from referring vets and specialists. The problem: this was that referring vets often miscategorised ulcers and proposed inappropriate treatments as a consequence. The stats: only 25% of diagnoses matched. Keratomalacia was correctly identified 60% of the time, and grid keratotomy was often suggested when it wasn't appropriate. The take-home: there's a clear need for more education on corneal ulcer diagnosis and management. Let's all brush up on our ulcer knowledge and sharing that ulcer knowledge. Paper number 6, post-phaco corneal ulcers. Age is a factor. R.N. Diaz and colleagues looked at corneal ulceration after bilateral phacoemulsification. The finding: older dogs are at significantly higher risk of ulceration. The stats: 17.9% of dogs developed ulcers, and age was the only significant risk factor. So, educate your clients, especially those with older dogs, about the increased risk of corneal ulcers after phacoemulsification. Paper number 7, looking at posterior synechia and post-op hypertension, a potential link. A.G. Dyer and the Texas A&M team investigated posterior synechia and post-ocular hypertension. They discovered that posterior synechia may be associated with an increased risk of post-operative ocular hypertension. The take-home: keep an eye out for posterior synechia in your phaco patients, as it could lead to post-operative ocular hypertension. Take home from paper number 8, proparacaine storage. N.S. Erickson and the veterinary eye clinic team looked at how proparacaine storage affects its efficacy. What did they find? Proparacaine stored overnight lost efficacy by week 6. Constant refrigeration, no problems. So, if you leave proparacaine out during the day, replace it monthly and keep it refrigerated overnight. Paper number 9, nicotinamide and glaucoma. E.L. Halsma and the team explored the effects of nicotinamide supplementation in dogs with an open-angle glaucoma. They found that nicotinamide significantly changed metabolite concentrations in plasma and aqueous humour, but had no effect on ERG parameters. So, nicotinamide shows promise for altering metabolites in glaucoma, but more research is needed to see if it impacts retinal function. And then the last paper that we looked at, TICA and VBO complications. B.J. Hartram and the team looked at ocular findings before and after total ear canal ablation and ventral bular osteotomy. When they looked at it, a whopping 77% of surgeries led to ocular or neuro-ophthalmic complications. So, thorough pre- and post-operative ophthalmic exams are crucial for these patients. And there you have it, folks, a whistle-stop tour. 10 take-home points from the ACVO meeting. We covered everything from corneal ulcers to glaucoma, and even a little bit about storage of our medicines. Remember, this is just a glimpse of the amazing research out there. Stay curious, keep learning, and as always, keep those eyes healthy. Thanks for tuning in to VetCast. Until next time, stay sharp.